Okay, so today I'm going to be talking about normal elimination patterns for babies. So the purpose of this is to teach parents what's normal and what's not normal when their baby is either going to the bathroom, whether it's urine, poop. We're also going to be talking about vomiting, diarrhea, signs of dehydration, constipation. So those are the topics I'm going to be covering today. So the first lesson is to know your baby's elimination patterns. So, whether or not they go to the bathroom around bedtime, middle of the day, after feeding, just knowing when your baby is going to be probably going to the bathroom, anticipating what's going to happen. So the first one we're going to talk about is urine. So what's normal when your baby urinates? Well, first off, your baby is going to be peeing around 6 or more times in 24 hours. That's normal. Next, you should be looking for the color your baby is peeing. So normally your pee should be a light yellow. Some things that are abnormal is if your baby hasn't been wetting the diaper. So the current guidelines is if your baby hasn't been wet in 8 hours or 4 or less in 24 hours. Also, if the color of the urine has a dark yellow tinge to it, like an amber color or like a brown or a pink tinge, those are some signs of colors that you should be aware of that's not normal. Also, if there's an unusual odor in the baby's urine, these could be signs of infection, inflammation, something to definitely contact your doctor or your baby's doctor for. Next, let's move on to dehydration. So babies that are not taking enough breast milk or formula, these are fluids that they're consuming, because obviously they're not just going to go crack open a bottle of water and start drinking it, because they're very dependent on their parents. So making sure that they're taking in the proper fluids. This can also be why the baby's urine is discolored. So like I said, the dark amber color could also mean that they could be dehydrated. So you'd maybe want to call your doctor and, find out a little more information, maybe give them a little more fluid. So signs and symptoms of dehydration, like we talked about before, if they peed less than 4 times in 24 hours or haven't peed at all in 8 hours, that is a sign of dehydration. Dry lips or mouth. So yeah, when we're not drinking a whole lot, we get the cracked lips, dry mouth, the cotton tongue. They can also have sunken eyes, and a sunken fontanelle. So that's the top of the baby's forehead. There's a little soft spot, so sometimes it'll sink. So a sunken fontanelle is something that you'd look for in signs of dehydration for a baby. They can also be irritable, and they'll have decreased activity. So like I said, you'll know your baby, and you'll know if they're not acting right. So let's move on to bowel movements. So what's a normal bowel movement for a baby? So normally they'll have 2 to 3 bowel movements in 24 hours, depending on whether or not they're breastfeeding. So that can be more frequently. Sometimes they'll go almost right after feeding. So like I've said before, you'll know your baby's pattern, their routine, when you bring them home and you get used to them, and you'll know when they're most likely going to go. But some things to look for that's normal in a bowel movement is the color. So most likely you're going to be seeing yellow, green, brown. These are all normal things with bowel movements for babies. Usually the consistency is kind of loose, soft. People like to say mushy, and then sometimes formed. What also is normal is when they're when they're moving their bowels, I should say. Sometimes they fuss, they grunt, they'll bear down. Sometimes their face will even turn a little red. This is normal when they're moving their bowels. So what's not normal is if the consistency of their bowels is constantly watery, or if the color of their bowel movement is bloody or mucousy. This could mean a lot of things. Sometimes irritable bowels, or maybe it's something they ate that just doesn't agree with them. They could have a food intolerance. So it's definitely something you should contact your baby's doctor about and discuss with him options. So along with bowel movements, diarrhea. So this is usually not normal for a baby. Diarrhea is usually a watery consistency, which can lead to dehydration. So like we talked about before in the video, you'll know signs and symptoms now of dehydration in babies, so make sure you're keeping a close eye on that. Another thing is constipation. So this is also not normal for babies. With constipation, usually the stools are very hard, almost kind of like a rock, like a little pebble, and they're definitely difficult to pass. Or sometimes they just don't go at all, and they haven't had a bowel movement in 3 or 4 days. This can mean that your baby isn't getting enough fluid, so they don't have enough fluid to pass that bowel movement through. Or the baby could possibly have an impaction, so the stool has been just stuck in there. This is something to also notify your baby's doctor about and figure out what's going on. So let's move on to vomiting. So vomiting, this is usually normal. When we think of vomiting, we don't think of it as normal, but for babies, it's more like spitting up. So spitting up, it's usually undigested milk or their formula. Usually it happens when they burp. They just kind of burp up a little bit, so they spit up. But what's not normal is actual vomiting. So usually large amounts of partially digested feeding, or they're like forcing like themselves to vomit. So this can mean a lot of different things. They could have a bacteria or some kind of virus that's causing them to vomit. So it's definitely something to notify your doctor about. So since we're talking about elimination, we can also talk about how often you should check your baby's diaper. So it's recommended that you should be changing your baby's diaper every 2 to 3 hours. They recommended that it's not necessary to wake your baby up if they've just wet their diaper, but always clean your baby if they've had a bowel movement. So this is important to keep the baby's skin free of all the bodily fluids that their skin will come in contact with. It can cause a lot of irritants, and in some cases it can even lead to infection, and that can just really hurt the baby. So we want to keep them as clean as possible and making sure that we're checking their diaper every 2 to 3 days. So these are just some of the normal and what's not normal things with your baby's elimination.